introduction. So this is my dissertation talk. So if you were unaware of what my dissertation, if you were unable to attend my dissertation defense like a month and a half ago, you're going to see the talk again. So I was working with Steve Meshnick and Mike Emsch at UNC, some of you may know them, on basically challenges to malaria control in the Democratic Republic of Congo and beyond. And so before I kind of go through everything that I was doing in my dissertation, I'm just going to give a brief outline of the talk. I'm not sure, are all of us malaria people? I'm guessing no. So I'll just give a really brief, trivial introduction to malaria, talk a little bit about malaria control, particularly in the context of like where we were and where we've come, and then I'll kind of outline my dissertation aims, which kind of address different challenges to malaria control. I'll cover some other preliminaries, and then I'll get on to each part of what my dissertation was on. And then hopefully we'll have some time for questions. I actually have to book it like right at 1, because I have a meeting at 1:30 at that other small school. So anyway, to start out, malaria is a vector-borne disease. It's caused by infection with the Plasmodium parasite, and it's transmitted by an infective bite from an Anopheles mosquito. And I think one of the things that is important to appreciate about malaria in general is that it's kind of a big thing. So it's not like something that's not important. It's quite important, and meaning that like 40% of the population worldwide is thought to be at risk of infection at any given time, but also that transmission is really heterogeneous across space. And so you can kind of see that in the map in the bottom left corner where, you know, sub-Saharan Africa kind of, and West Africa in particular stands out as being a particular hotspot for transmission. And then in places like Latin America, transmission still occurs, but at a much lower rate. And then some of that heterogeneity, which is kind of this thing that's frequently described but not fully understood, is, I think, in large part the result of very complex interactions that we haven't fully wrapped our heads around. And in a big picture sense, some of this is probably due to there being 30 to 40 different species of Anopheles that transmit the parasite to humans. And then, you know, since it's a vector-borne disease, any sort of transmission or interest in transmission inherently involves two populations. So there's the human population and the vector population. And as a general rule, studies done on malaria and studies related to malaria usually just focus on one of those things. And then also these interactions that have to happen between mosquitoes and humans are occurring in an environment, like a local environment, and that itself is really, really heterogeneous as well. And so kind of all of these different interactions that are quite complex are presumably giving rise to this heterogeneity in transmission, and trying to understand that better is in a big picture sense what my work is trying to do. Now that being said, you might think that it's kind of like this impossible thing to control, but over the last 10 or 15 years, we've actually made a lot of progress in reducing transmission worldwide. So, you know, in the year 2000, it was estimated that there were roughly 850 or so thousand deaths a year, and that's declined by roughly 50%. You know, now we're seeing in 2015 there were an estimated 430,000 deaths per year. Taken another way, we've also seen a dramatic reduction in cases worldwide. So, you know, over that same time period, there's an estimated 663 million cases that have been averted. And this is largely the result of, you know, a small set of interventions, which is particularly interesting in the sense that if you're averting like 660 million cases of malaria in a context and a transmission patterns that are really complicated, you would think that the interventions would be really complicated. But in fact, you know, they're quite a, you know, just a few of them, like 3 or 4, that are responsible for most of these reductions. In particular, those are insecticide-treated bed nets, which I'm going to focus on, or which I focused on in part of my dissertation, and those are thought to be responsible for roughly 2/3 of the reductions in transmission. And then there's indoor residual spraying, basically spraying an insecticide on the inside of a house, and it presumably kills the mosquito that lands on the inside of the surfaces of a house, and then there's also been a concerted effort to increase diagnosis and prompt treatment. So, you know, if someone has a suspected case of malaria, you know, confirm the diagnosis and then give them some sort of artemisinin-based combination therapy to kill the parasite. That being said, you know, we still have a lot of progress to go. So, like 430,000 deaths a year that we estimate is still way too high. Like, ideally, the number is 0. And there are still far too many cases, that still exceed, 100 million per year. I don't remember the number exactly off the top of my head. And so that kind of raises questions as to what remains a challenge to trying to control malaria into the future. And so, it's a dissertation, so there are three, of course. And I focused on agriculture and malaria, the continuing role of bed nets in reducing transmission, and some threats that might be present in terms of reducing their effectiveness. And then kind of a big picture question is like, okay, well, how does malaria spread? And I think anybody who's interested in infectious disease in general is, kind of the first question is, well, how does the disease spread? And that's kind of an open question in malaria in many respects. And it's actually an open question methodologically as well, from a statistical point of view. This is really weird. I like this. Just staring at the TV. Before I dive into the dissertation talk in general, I just want to say that all of my dissertation relies basically on a single data source, and that's the Demographic and Health Survey program. Who's familiar with those data? Steve, raise your hand. You're familiar with HS data. Okay, so basically, these are population-based surveys that are designed to be representative at the national level. Also regionally, so you can think about like provinces within a country, and then across the urban-rural divide. And to achieve this, basically this involves going to several hundred locations or clusters in a country and sampling thousands of individuals overall, so that you kind of cover all of a country in terms of the spatial extent, but then have enough sample of the different demographic characteristics. And different regions in a country. And these surveys are designed to provide estimates on a wide range of indicators, from HIV, socioeconomic status, malaria, of course, and a number of other things, education, etc. And then I'm also using malaria indicator surveys. They're basically the same thing as a demographic and health survey, same design, but they focus more exclusively on malaria. So kind of with that out of the way, I'm going to go ahead and turn to the first of my dissertation aims. And this was on agriculture and malaria risk in under 5 children. And I want to motivate this by saying that while I talked about introduced very briefly these interventions earlier, none of them really focused on ecology, yet it's kind of increasingly becoming understood that ecology is a prerequisite to malaria control. And I want to make the case that agriculture is a critical part of that ecology. And in sub-Saharan Africa, the reason for this is that it produces the habitat characteristics that are favored by the Anopheles gambiae mosquito. And when I mean habitat characteristics, I mean like the Anopheles gambiae mosquito's ideal breeding habitat is transient pools of sunlit mud. And so kind of in the image on the left here, you can kind of see these Congolese farmers who are watering their agricultural plot, and kind of in the canal there you see a transient pool of sunlit mud. At the same time, it might be something that we think is important for transmission, and it might increase risk, but, kind of in epidemiology and public health, an exposure might, be important statistically, but if no one's exposed, it's not a problem. But agriculture is presumably going to be a big problem in sub-Saharan Africa, in the sense that the population is expected to double from roughly 1.2 billion people now to 2.5 billion people in 2050. And this is going to require a lot of agricultural development to feed the population. And then other countries like China are investing in agriculture in sub-Saharan Africa as well. And so from the perspective of trying to feed a country, this is going to require agricultural development, and that's a primary objective for the Food and Agriculture Organization in the Congo. So if you go to their website and their country landing page for the Congo, they'll say, mission number 1 is to develop the agricultural sector. And on top of that, the DRC already has a very high malaria burden. It has one of the highest malaria burdens in the world. Roughly a third of the population is infected with malaria annually. But there's some variability by different demographics, and there's spatial variability as well. I'm not the first person to focus on agriculture and malaria. There's actually quite a bit of work done on this. And a lot of the work kind of focuses on the mosquito population and does a pretty nice job of looking at the effects of land cover and environmental change and what happens to different mosquito populations in different regions of the world. And in particular, to take as an example, this study by Lindblad and colleagues found, among other things, that deforestation and conversion to agriculture is associated with kind of different transmission parameters, such as indoor resting density. So the idea is you clear a forest, develop it for agriculture, and somehow Anopheles mosquitoes are resting indoors in higher densities. That being said, that doesn't necessarily lead to increases in malaria risk. So, one limitation of these studies is that they don't actually observe transmission. They kind of observe a behavior of a mosquito, but they don't necessarily observe a mosquito biting a human or transmitting malaria. And this is something else that's kind of known in the literature. To take an example, there's this thing called the Paddy's paradox, where under certain circumstances, agricultural development in a rice cultivation context has actually seen decreases in malaria risk, either due, for example, to better irrigation practices that actually lessen the effects of the breeding habitats that are preferred by these populations, or in Southeast Asia, and in other settings as well. And there's also a lot of confounding there, right? So if you don't observe transmission, you're probably also not observing things like whether or not an individual is sleeping under a bed net. And so, one of the thoughts behind why this Paddy's paradox might exist is to say, okay, well, maybe these people have different agricultural practices, but it's improving their socioeconomic status, their housing material gets better, maybe they're sleeping under bed nets because they're more aware of the risks, and none of that is measured. So just kind of you have confounding in a number of these studies. And they're often done at a small number of sites. So to kind of take another example, this top paper by Lindblad and colleagues, is working in a highland area of Uganda. But people working in malaria know that transmission tends to be less in highland areas than in lowland areas. So there's kind of a representative problem there. You can't really generalize to what might be happening in Uganda in general. And then, as I mentioned, a lot of these studies lack data on other important factors governing transmission. And so that's kind of what largely motivated the study that we did in the Congo, which is to try and assess the relationship between agriculture and the mosquito population there, as well as agriculture and malaria risk. And so the data that we're using from this is, again, demographic and health survey data from the Congo, and that involved 4,600 children under 5 who are living in 331 rural communities across the Congo. And those guys are represented by the 331 communities are in the red dots in the map on the left. And then to try and address what might be happening in the mosquito population is at the same time that the demographic and health survey was being done, there's ongoing entomological surveillance work in the Congo. We have a collaborator with CDC who kind of leads that work. And so they were collecting mosquitoes, in this case from August 2013 to July 2014, doing it roughly every 3 months. And right in between that time frame is when the demographic and health survey was conducted. And so we're basically going to do 2 analyses in one and try and kind of say, okay, well, these studies are, these surveys are being done at the same time. So this is kind of as good as it gets. Plus, with the DHS, we can actually draw inferences at the population level. And then the mosquitoes sampling was done a number of ways, but the way that we're interested in looking at it here is by human landing catch, which basically involved someone sitting outside a household and someone sitting inside a household all night and waiting for a mosquito to land on them, and then they just caught it. And so the outcome of interest here is the malaria status in each child. That was done in Steve's lab using PCR. And then entomology outcome of interest is whether or not a mosquito was caught biting indoors or outdoors. And so this is kind of a behavioral outcome. You can think of it as a transmission parameter, such as common in other studies on mosquitoes. And then the exposure of interest is the percentage of land cover around each survey cluster and entomological surveillance site that's agriculture. And that was derived from satellite data, the MODIS platform in particular. And then one thing that's nice about working with demographic and health surveys, for those of you interested in public health and want $10 million data for free, is you can control for a lot of potential confounders because they're really rich data sets that have a lot of demographic information and they're spatially referenced, so you can get environmental data if you want. And then in the entomology data, we don't really know demographics of mosquitoes, so we just control for kind of these environmental features that we can measure. And then methodologically, in my dissertation, I had a commitment to not have any fancy equations in my talk. So we're basically just doing probit regression. And the first model is a probit regression model with just a random intercept, and that's just to account for the sampling design of the survey. And you can think of these random intercepts as kind of like, well, dealing with unmeasured confounding. And then malaria is an environmental process, right? There's a lot of environmental determinants of malaria that govern how malaria is transmitted, and environmental features are often spatially correlated. So you might think that some of the unmeasured confounding is spatially correlated. So we attempt to address that by allowing that intercept to vary spatially, and then we introduce a spatially varying coefficient process, which allows the effect of agriculture on malaria risk to vary spatially as well. And the rationale for that is in the DHS survey data, we don't observe the mosquito population, and it might be heterogeneous. And thus, as a result of that, for example, if there's an area where there aren't any Anopheles gambiae mosquitoes and the Anopheles population is something that doesn't really respond to agriculture, you might see the effect respond differently as well. And so we're kind of trying to address that confounding. And then on top of that, we don't observe the type of crop, right? So if as I said, the Anopheles mosquito really likes transient pools of sunlit mud, but your crop is something that provides shade, you might see a negative effect there as well. So it's basically just kind of a fancy model that can help address unmeasured confounding. And so just kind of the results from fitting these models is, first and foremost, we kind of see that there's a positive effect of agriculture on malaria risk in general. It's a probit model, so the results are kind of hard to interpret, but one thing that we can do is look at the sign of the coefficient, it's positive, and the posterior probability that it's positive is quite high. And so we're kind of see some strong evidence that it increases malaria risk. And then to kind of put that in an epidemiological context that we can kind of wrap our heads around is that if we see a 15% increase in agricultural cover, we'll also see it'll be associated with risk differences ranging from 0, so really no effect, to about an increase of 3% in your risk. And that depends on other factors, such as whether or not you sleep under a bed net treated with deltamethrin or not. And I'll return to that in a moment. From the side of entomology, in terms of trying to link hypothesized mechanisms to what we observe in transmission with humans, is we also see that I'm kind of hypothesizing that this relationship might be mediated. This increase in risk might be mediated through increased indoor biting among Anopheles gambiae mosquitoes. So, as you might recall, with the human landing catch, you have people resting indoors and outdoors waiting for a mosquito to land on them, and we can imagine if they're landing on a human, they're probably going to bite them. And so, with increasing agricultural coverage, we're also seeing, as was seen before, increasing indoor biting among Anopheles gambiae mosquitoes, and that also has fairly strong evidence of an effect. One thing that's important to note, though, is that when we're controlling for bed net uses, I control for it in terms of what different insecticide the bed nets were treated with. And if you look, permethrin, there's really no effect. There's no protective benefit in the Congo for sleeping under a bed net that's treated with permethrin. And this is kind of a problem, right? So if the background ecology is changing for whatever reason, for agricultural development, and this is leading towards mosquitoes to increase their time indoors and increase indoor biting, and sleeping under a bed net that doesn't do anything for you is not going to help. And so you'd want to be sleeping under a bed net such as deltamethrin, which has a very sizable protective effect in the Congo. And that's what really led to kind of the second aim, which is to try...
Are you taking questions in the middle, Heather?
Sure.
Sorry,
are you a feminist? That's what they do, yeah.
Just for the agriculture, is it any agriculture, or what does that mean?
So we don't observe the type of agriculture. So there's other data out there that I've recently become aware of where you can test that apart. And so that's kind of one motive. Since you couldn't observe type of agriculture, that was one motivation, the spatial slope. Although I forgot to mention the spatial models actually didn't fit the data as well. And I'm a spatial statistician, so that kind of ticked me off. But that's beside the point.
Can I ask you a question?
Yeah.
Is it just agricultural land cover compared to non-agricultural? What are the other alternatives? What are the alternative? I assume that you classified each unit of land in some mutually exclusive category, of which agriculture was one.
Yeah. So for me, it was like whether or not it's agriculture.
And the other possibilities were like
forest
urban?
covers a possibility. I'm actually going to be writing a dissertation or a grant to aim on different mechanisms of agricultural conversion, like deforestation and stuff like that. But for the purposes of this, it was just basically like how much agriculture are you surrounded by? Yeah. But that's a good point.
But other land cover types are like forest and urban? Or?
There's forest, there's urban, although this was done strictly in a rural setting because in the Congo, most agriculture is kind of smallholder agriculture, and so it's not really happening in urban areas. But peri-urban areas would be interesting too.
I assume that what they grow in these agricultural areas must vary from one part of the country to the next, right?
Yes.
Like I assume they grow different stuff in the north than they do in the south. It's kind of dry down there.
Yeah, I used to know off the top of my head the 5 major crops, but like cassava's one.
I'm sure.
Like rice is one. I don't think it is.
But did y'all explore if the effect was modified by inferences about what they might have been growing, like by ecozone or by region or something like that?
Yeah, so I think for the purposes of this, that was one of the, since we weren't able to observe it of the different types of crops, it's like, well, if there's confounding as a result of that, that might show up as a spatially varying slope. So it's like, but it would be better to measure it. And so the remote sensor on my committee pointed to a data set that was just released a few months ago where that sort of stuff can be picked apart. Yeah.
I don't know if you said this already. It was MODIS data, right? So what was the granularity?
It's 500 meters. And then the data that the European Space Agency just released their project is like 30-meter resolution, which and also has a lot more granularity in terms of like type of crop, for instance. And so I might work with the remote sensor who's on my committee to try and do that, but I'm not a remote sensor, so I didn't, and the data weren't released when I was working.
So how well does that spatial scale fit with the size of the plots?
What do you mean?
So you said that it's smallholder plots, which I assume are a hectare or less.
Yeah.
Right? So if you have a 500-meter pixel, that's a lot bigger than the plot.
Yeah, so I mean, the scale is an issue, and actually we have data on how much agriculture each household owns. But I guess the way that I was thinking about this in terms of, from an epidemiological point of view, is more like, okay, well, how much agriculture is around your community versus how much is your own personal plot? And I'm not sure that's the best way to do it. I mean, mosquitoes, the maximum flight distance of an Anopheles mosquito under experimental conditions is like 10 kilometers, but usually it's a few kilometers. And I don't necessarily know that they would prefer one. Like if they're on your plot, they follow you to your household. But they might, I have no idea. Any other questions?
Is there a link between soil degradation, agriculture, and the proliferation of these mosquitoes? Or was that studied at all? Or
I'm going to say yes, but I'm not really familiar with it. I'm going to say yes because there has been a fair amount of work on what pH mosquitoes prefer in the soil and stuff like that. And I don't remember the answer, they prefer something in this range or that range, but that would be related to soil degradation and stuff like that, I think. You looked on that?
Yeah, we looked at pH with larvae and where larvae like to grow. We didn't see much relationship with pH.
So then the answer is no.
But that was with water pH, not soil. So.
Well, presumably.
They'd be correlated.
Yeah. Okay. Any other questions? Okay. So anyway, the kind of the aim one, to summarize briefly, was to say, okay, well, if this ecological process leads to a mosquito population biting indoors in higher numbers or at higher rates, however you want to think about it, and we at the same time are observing that certain types of bed nets aren't really effective at reducing transmission or providing no protective benefit, then what does this look like in terms of bed net effectiveness? And so this has been kind of a concern in the global public health community for a while. And TropMed, there have been a number of talks on insecticide resistance, and there's a lot of work being done on it. And so it's obviously a concern. And then on top of that, it's a concern because it's basically been the one thing that's responsible for 2/3 of the averted cases over the last 15 years. And so kind of, my thoughts are, or maybe, I don't know how many other people think this, but I presume it's a lot, is that continued transmission reductions are going to depend on the continued efficacy of bed nets, because it's, a relatively easy intervention compared to some other alternatives. That being said, insecticide resistance has emerged across sub-Saharan Africa. And monitoring it actually, and the consequences of insecticide resistance is actually pretty hard from a public health policy point of view, at least in my opinion, and I'll go into that in a minute. But before I do, kind of the results from the previous work have, there's just, as I said, there's been a lot of work done on this all over sub-Saharan Africa, and among other things, the molecular mechanisms of resistance, molecular markers that have been identified for this thing called knockdown resistance, which is basically if you land on a net, a mosquito's supposed to die. And so kind of the molecular mechanisms underlying the resistance mechanism have been identified. And then there are a number of studies out there, a lot of work either published or in the gray literature, that are doing experiments to be like, okay, well, we caught these mosquitoes, how many of them are being killed 24 hours after exposure to these nets? The epidemiological consequences aren't entirely clear. There's some studies where, so for example, in Senegal, there was a study that found, they did a mass bed net distribution, and basically it wiped out malaria. And then 27 to 30 months later, it rebounded to, the incidence rebounded to where it was, nearly where it was before. And much of that rebound was attributed to insecticide resistance. At the same time, other studies have found that the prevalence of these molecular markers related to insecticide resistance have gone up significantly in response to bed net interventions, and yet the bed nets still remain efficacious for possibly for reasons not related to the insecticide. And on top of that, I think it's also important to appreciate that the insecticide resistance is really heterogeneous, even over short distances. So if you look in like the southwest corner of Ghana here, you basically have this green square where the mosquito population there is susceptible to the insecticide, and then just north of it, it's resistant, and then just north of that, it's kind of in this transition phase, suspected resistance. So kind of like 80 to 97% of the mosquitoes are being killed, and so that's basically saying you're on your way to having a resistant population. And so one of the consequences of that, in conjunction with the fact that it's actually, I'm convinced, impossible to draw a representative sample of a mosquito population, certainly at the country scale, is how do you make a decision, right? So if you went to that one study site in Ghana and were like, oh, well, it's resistant, we have to change insecticides from deltamethrin to permethrin, for instance. Or if you went, just next door and found that it was susceptible. You can't really make decisions based on this. And a lot of bed net decisions are made at the country level. And this is not something that is unknown to the World Health Organization or the global health community, the malaria community in general. And so the WHO's pesticide evaluation scheme basically has said, we should do one of two things. We should either do these longitudinal studies that can kind of track resistance over time, such as what was done in the study in Senegal in that one village, or use kind of these retrospective population-based surveys, which are really great because they cost $10 million, but were done for some other purpose, so the malaria community doesn't have to spend any money. And so one of the nice things is that this can be done with DHS data to a certain extent. And so the objective of this aim was to assess the effect of bed nets treated with different insecticides kind of across, wherever there was data available in sub-Saharan Africa. And so here I'm using 33 demographic and health and malaria indicator surveys that were conducted across sub-Saharan Africa from 2009 to 2016. And so the countries outlined in red on the left are where we're working. And then I just kind of made this plot that shows the type of survey, the year the survey was done, the sample size, and the country, just to kind of get a sense of what, all data is being included here. Similar to before, the method of, or the outcome of interest is the malaria status of each kid under 5 years of age, and in these data we have 168,000 children under the age of 5. And then the exposure of interest is the child's bed net use according to the insecticide use. So basically whether or not they slept under a deltamethrin-treated net, a permethrin-treated net, or an alpha-cypermethrin-treated net, or other. And we were able to identify this because the DHS and MIS surveys actually collect the brand of bed net that's used, and so you can usually use that to identify, well, in about 88% of cases, you can use that to identify the insecticide. And for the other 12%, it's maybe a local brand of net that doesn't really have a manufacturer with a website where you can look up what insecticide was being used. And then methodologically, this is really straightforward. There's really nothing fancy here. It's just logistic regression and stratifying by country and year. And so kind of this was done from the perspective of if I was sitting in a Ministry of Health and I wanted to understand whether or not deltamethrin nets were working in my country, I would probably be working with data from my country and fit a logistic regression and estimate an odds ratio. And then as before, we're going to control for potential confounders. And the results, we can just plot really quickly, and it's not so much to see any spatial pattern per se, but just in as a quick way to try and see what we can see. If we look at deltamethrin and permethrin, Nigeria stands out as a place where they don't really, neither insecticide appears to be of any benefit, which is perhaps not surprising because Nigeria, I think, has the highest malaria burden in the world still. And from 2010 to 2015, when the 2 surveys there were done, there was a small, maybe a 5% decrease in malaria transmission in spite of what I imagine are a number of interventions designed to reduce transmission. Consistent with before, deltamethrin appears to work and provides a protective benefit with maybe a 20% reduction in odds in the Congo, but permethrin doesn't really have a protective benefit. Tanzania, neither appears to work, but if we move to alpha-cypermethrin, Tanzania has the strongest effect, or it's most protective in Tanzania. Alpha-cypermethrin is a little harder to work with because there's a lot of imprecision owing to far fewer people sleeping under these types of nets. So some of these results are kind of uninterpretable, they're not uninterpretable, but you couldn't really make a decision around what bed net you might want to use as a result of it. But really the overall objective here was to try and fill in a gap to say, all right, well, if the global public health community wants to monitor insecticide resistance or bed net effectiveness in general, you presumably want to be able to do so at a population level since decisions are made about populations, or hopefully made about populations. And so you can do that with demographic and health survey and malaria indicator surveys. So this was actually really low-hanging fruit that just kind of fell in our lap by knowing that some obscure variable in a data set can give you what you want. And so I just briefly listed which insecticides were effective in which countries, but I won't go through that. And then finally, the last aim is, for me, I think one of the more interesting ones and one of the more challenging ones, and something that lab people have been struggling to figure out, and I'm not a lab person, so I don't know anything about that side of things. But also, ecologists and population geneticists have been trying to figure out is, trying to understand, population structure, or more broadly, like how an infectious disease might spread. And so, kind of the big picture question here is how does malaria move from place to place? We talked in. For the first aim that, they have these human-mosquito environment interactions, and so you can imagine that over short distances, transmission is governed by movement of mosquitoes. But over larger distances, since mosquitoes don't move that much, it kind of has to be spread through the movement of humans. And this is important for malaria control for a variety of reasons. Two are, let's say, we successfully eliminate malaria in a village, say the village, on the screen here, but someone who has malaria decides to come to that village for whatever reason. and let's say the ecological conditions, there's still Anopheles mosquitoes there, there's still people capable of being infected, and it's just that there are no parasites circulating in the population. Well, if this person brings the parasite to that village, you can have an epidemic emerge. And this is kind of a concern in malaria control is, how do we prevent that from happening? And that requires us to understand how it spreads. And then another concern, arguably a bigger one, is the spread of drug resistance. So if you observe drug resistance in a place such as Southeast Asia, you want to be able to prevent it from spreading. And so, if there's drug resistance in the Congo, and you can kind of figure out where it is, you also want to understand how the parasite is spreading such that you can prevent it from moving other places. So a lot of work has been done on this. Steve Taylor's actually done a fair amount of work on drug-resistant malaria in the Democratic Republic of Congo. In fact, that second image is from a paper of his. And one thing that's a challenge here is that data on human movement is often very limited, particularly in developing country settings. So there's data out there that talks about migration between countries, like from census records. But that's of limited value for the spread of malaria within a country, even if you had those data between country movement. And then migration within countries, there are a lot of people in the UK. There's a big group that's working on trying to measure this with like mobile phone data. But that's kind of hindered by the fact that it's going to give you a biased sample, particularly in the Congo, where not everybody has a mobile phone. And then, that being said, we can use genetic data to kind of more directly estimate malaria spread. And so kind of, you can look at the similarity between malaria parasites in different places. You might be able to infer how people are moving. And then that being said, work in the DRC is growing. So as I mentioned, Taylor's done a lot of work on drug-resistant markers. These can be problematic for trying to understand spread, and you kind of prefer to use neutral markers that aren't under any sort of selection, so that you're not kind of basically biasing your results by having some other process that's governing the structure and then making an inference that it's movement when it's not necessarily that. And then at the same time, there's still small samples, and so the work done on the bottom left, is trying to understand whether or not the Congo River is kind of an avenue for malaria spread, and there was a really nice experiment that was set up, but it didn't find anything, and the reviewers were like, "Oh, this is probably underpowered." And one of the nice things about this study is that it was drawing from demographic and health survey data, so it had a nice random sample, but then it's a random sample from a random sample. So if you have hundreds of locations, and this has 6 or 7, but that's usually done because of cost. It's very expensive to do some of the lab work. So anyway, the objective of this aim was to try and explore malaria gene flow in over 5 children in the DRC. And we're going to do that using malaria parasites from 608 children living in 301 communities across the DRC, and so those are represented by the red dots again. And then we're looking at 28 neutral loci, neutral microsatellite markers using these things called molecular inversion probes. I understand nothing about them, but the University of Massachusetts people understand them, and they're cheap. And basically it allows you to kind of do some population genetic work in a setting where you're not really constrained as much by cost. I did a lot of stuff to look at population structure here. I'm just going to present, the results from these things called permutations of GSTs, which I'll explain. And this was basically designed to kind of set up different experiments for how the parasite might be spreading. And so, first and foremost, we work in the Congo, and we think that a lot of human movement is governed by local interactions between an urban area and its immediate surrounding areas. So, we basically picked 4 urban areas represented by the red dots here in the left. Hopefully you can see those. Kinshasa is the one in the farthest left. Kisangani is the farthest north. Goma is in the east, and then Lubumbashi, which is the second largest city in the Congo, is in the far south. And then, as I mentioned, we think that there's a lot of economic circulation between urban and immediately surrounding areas. So, for example, in the case of Kinshasa, we can just look at the parasites in Kinshasa and try and compare them to the surrounding rural areas. Do the same thing and the other places. And so these are areas where we think that there might be a lot of gene flow, like a lot of malaria moving from place to place, as a result of a lot of people moving from place to place. And then on the flip side of things, well, you can kind of imagine that distant urban centers will be connected for economic reasons. So the province that I've circled here, Kisangani is here, and then Kinshasa is here, and so we can compare those populations. We think that they're a bit more distant than an immediate surrounding rural area, but they might still have some relationship. And then you can go further afield and kind of compare Kinshasa and North and South Kivu, which are further away from one another, but still kind of connected to the Congo River. And then just kind of as a different setup is, what about these two areas here? They're not connected by anything. There's no reason to go from one place to the other. And so you might expect there to be a lot of differentiation between the parasite populations. And so I have one equation in this talk, and it's kind of confusing. It's simple, but it's this thing called GST, and there are a lot of different statistics that estimate population differentiation, and basically it's this equation, the HT minus HS over HT, where HT is the gene diversity or kind of expected heterozygosity in the total population, and HS is the gene diversity in the subpopulation. And so theoretically, this statistic lives in 0 to 1, where 0 would mean that there's like perfect gene flow, and that would occur when HT equals HS, which would mean kind of like basically, so if you want to kind of put it in real terms, like if we were comparing ourselves to the rest of Duke, like if we were exactly perfectly equal, if we all had brown eyes, the rest of Duke all has brown eyes. So that never happens, right? And then 1 is indicative of a strong barrier to gene flow, which is when like HS equals 0, which would again be like we all have brown eyes, and that's it. Like there's no diversity in this room, which is not practical. Like that never happens. And so the reality is that it's not true. And unfortunately, this means that the statistic itself can't really be interpreted. Like you'll get a number, but you can't figure out what it means. But what you can do is just like randomly permute the population assignments. So I can randomly move some of you outside of this room and make you part of the Duke population, and move people from the Duke population back in here. And so that basically generates a random sampler. And then we can just plot what you would expect under randomness and plot the statistic that we observe from the observed data, and compare them. And so that's basically what we do here. And one of the things that's interesting is we don't actually see any strong evidence of gene flow. So these curves with the red areas in there are just kind of the 2.5% and 97.5% uncertainty intervals. And so none of and the blue arrows are our observed statistics, and none of them are falling in a range where we would say reject the null of strong evidence of gene flow or strong evidence of differentiation. And that's true for all of these cases. What's also interesting is we see the same thing in terms of like having areas that are further and further apart. So to take this example, we don't really see any strong barrier to gene flow from these two areas. That there should be a strong barrier. You would think there would be, because people are presumably not moving between those places. And so, there's maybe some weak evidence of gene flow in the sense that, these arrows are on the left side of the distribution. But, that weak evidence might be due to weak infrastructure in the country. That being said, if there's weak infrastructure, you would think that there would be strong evidence of barriers to gene flow, but we don't see any strong evidence of it. And kind of one possible explanation is that there's just so much malaria there that kind of everything is everywhere is one explanation. And then, and Steve Meshnik and I talk about this, he's like, okay, well maybe the infrastructure is terrible, but the parasites are still moving faster than they mutate, or something like that. So it kind of didn't work, but in spite of all of the investigator bias that we had, we're now convinced that there's not a lot of population structure in the malaria parasite. And that's a quote from Steve, my advisor, so I can say that. So in conclusion, the overall goal was to kind of address some challenges to malaria control. And first and foremost, interest was in trying to identify aspects of the ecology that might be relevant for transmission in the Democratic Republic of Congo. And in the process of doing that, we found this other interesting finding that certain bed nets aren't really effective, and that has consequences if there are ecological processes going on that that can render bed nets, or that can increase the likelihood of being bitten indoors, and that would mean that a bed net is of extra importance. So we kind of turned to try and address this across sub-Saharan Africa using all of the available data, and we're able to kind of basically provide a really easy tool for monitoring insecticide resistance or bed net effectiveness generally in malaria endemic countries where these surveys are done. And then finally, we're trying to understand how the malaria parasite spreads, and this is relevant in the Democratic Republic of Congo. So there's a lot of resistance that's kind of clustered in the northeast of the country, based off of some of Steve's work. We found that, and so we might want to understand how it might spread. And this is something that we still haven't figured out, but we're making progress. And maybe there's not population structure, which we're kind of convinced of, but there's still more work to be done. And so that's it. Any questions?